Today we're going to talk about viscosupplementation injections, also called as the gel injections or the rooster cone injections or the hyaluronic acid injections. So this treatment works very differently when compared to cortisone or the platelet-rich plasma injections. So I'm going to share a clip from my YouTube video where I delve into this topic further.
We all have some lubricating fluid inside the knee, and one of the component of the fluid is called as hyaluronic acid. In arthritis, this particular fluid is decreased, causing friction, resulting in inflammation, causing the swelling and pain. So it makes sense to put a lubricating gel inside the knee that should be able to decrease the swelling and inflammation. When we look at the evidence, most of the studies have compared hyaluronic acid injections with saline injections, and some have compared them with cortisone injections. So basically, in summary, hyaluronic acid injection is not better than placebo in blinded studies. This means that in studies where patients don't know what they were getting, whether it was a placebo or an hyaluronic acid injection, the improvement in knee function did not differ much. However, unblinded studies, which means that where patients knew that they were getting an hyaluronic acid gel injection, they showed better results than placebo. So this questions the efficacy of the placebo effect. However, one unblinded study did not show a significant benefit when comparing an hyaluronic acid injection with a steroid injection. Observation studies that look at how patients are doing after a hyaluronic acid injection do notice an improvement and justify the use of the injection. So there was one study, they found that repeat cycles of injections can provide more pain relief. So in a clinical scenario, if a patient reports that an injection helped a little bit at 6-month mark, but not much, it may be beneficial to try the injection again before concluding that it does not work. So this study found that there was almost a 10% increase in patients responding to the injection the second cycle.
So the hyaluronic acid injections can be a great option to help manage the pain and the stiffness that comes from knee osteoarthritis. But remember, there is no single injection that is a magic bullet. The injections are a part of the treatment plan, but it's also important to make sure that we build the strength and the foundation of the muscles that support the knee joint as well. And that's where physical therapy comes into play. So make sure that you're doing your rehabilitation pretty regularly, in addition to considering these injections as well.